Hello everyone. Today we are going to see about osteokinematics.
Osteokinematics. Osteo means bone. Kinematics means movement or motion. Osteokinematics is a gross bony movement that is happening around the joint. Osteokinematic movement are used to describe the actions of muscles upon the bones and joints. Muscles contract to produce movement at joints, and the subsequent movements can be precisely described using following terminologies. These terms used to assume that the movement begins in the anatomical position. Flexion. Bending movement of one bone on another, causing a decrease in the joint angle between the articulating surfaces. Example: elbow flexion. Bending the elbow to bring the forearm upward. Extension. Stretching or straightening movement of one bone from another, causing an increase in the joint angle between the articulating surfaces. Example: elbow extension. Bringing forearm back to its anatomical position. Abduction. Bony segments moving away from the midline of the body. Example: shoulder abduction. Upward lateral movement of humerus out to the side, away from the body. Adduction. Bony segments moving towards the midline of the body. Example: shoulder adduction. Downward movement of humerus, arm towards the midline of the body. Medial rotation, also referred as internal rotation. If the anterior surfaces moves inwards towards the midline, it is called as medial or internal rotation. Example: medial rotation at the hip joint can be achieved by rotating a fully extended lower limb internally towards midline of the body, so that the big toe points inwards. Lateral or external rotation. If the anterior surfaces moves outward away from the midline, it is called as lateral or external rotation. Example: when a fully extended lower limb is rotated outward at the hip joint, the big toe points away from the midline of the body. Circumduction. Circumduction is a motion involves a combination of four joint motions such as flexion, abduction, extension and adduction, or in a reversed sequence. Example: moving your arm in a circular manner at the shoulder joint while keeping your arm straight. Dorsiflexion. Dorsiflexion is the movement of the foot and ankle that bends upward and towards the leg, as foot and shin approximate closer together. Plantar flexion. Plantar flexion is the movement of the foot and ankle that bends downward and away from the body, as when the top of your foot points away from your leg. Inversion. Inversion is moving the sole of the foot inwards at the ankle joint, inverting sole of the foot towards midline. Eversion. Eversion is turning the sole of the foot outward at the ankle joint. Sole facing away from the midline.